friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to Louisiana Living. We are Physical Therapy and Balance Centers. I am Angela Yarborough and this is Dr. Jerry Yarborough.
Hey, welcome guys. Can you believe it's been 9 months since we started doing this segment?
No, like 9 months. I think back on all the things that we've talked about, and it's just 9 whole months of helping people love their life.
Right.
And that is like what we love doing, and it has been so fun and so fulfilling. We've talked about, I'm trying to think, like COVID. We've talked about Aaron, I can't ever say that word, sitting at your desk properly, and pain, which brings me to, I want to talk about me today. We always talk about you. I want to talk about me today. Imagine that. But I've been writing
about you.
No, it's not about me.
What's going on?
But I'm sure I'm not the only one. I've been writing a book, and so I've been sitting at my desk a lot, and my neck and all the way down my shoulder just hurts. Okay. So let's talk about that.
All right, we can do that. So neck pain. Neck pain can be caused by a lot of different things for different people. It could be a strain, it could be positional, working at a workstation improperly or not taking proper rest breaks, like whenever you're just deep into writing your book. It could be, a degenerative condition of your cervical spine or a herniated disc or even something traumatic. But today we will focus on you. Because you are very important. And so we're going to talk about positional neck pain, okay? So like you're working at a workstation for an extended period of time. As we've talked before, you need to take a break every 20 minutes. That means you got to get up, you got to move around, got to do some neck stretches and watching your posture. Your workstation, even when you're working from home, as we've talked before, needs to be proper. You need to have proper position of your computer. It needs to be in front of your, in front of your eyes instead of down. And Your keyboard needs to be here instead of up here, and all of those things. So being in a position for a prolonged period of time can really cause some neck pain as it's caused you. So, in the next segment, we're going to talk about some things that you can do today. If you have positional neck pain, it can be very debilitating. It can interfere with your life and your sleep, as it has been with Angela, therefore us also. So it's very important. So come back in the next segment and we'll talk about some things you can start doing today to help. Thanks. Hey guys, welcome back. I'm Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers. I'm here with my sweet wife, and today the impairment that we're talking about is positional neck pain. We just mentioned in the previous segment, Angela has just finished writing her book, so she's been spending a lot of time over on her desk for longer periods than she should have at a time. Remember, anytime you're going to be working at a workstation, your ergonomics needs to be like we talked about previously, and you've got to take rest breaks every 20 minutes. Got to get up, move around, stretch, do something. Angela didn't listen to the advice of her personal doctor, so she's hurting. So anyway, we're going to show her yet again some exercises, stretches to do to help overcome the neck pain that she's had. All right, so first you want to sit up nice and straight. We're going to start with some stretches. You're just going to bring your ear down toward your shoulder and just do it until you feel a gentle stretch. If it's causing you pain, then you're going too far and you're going to cause more pain. We don't work on the no pain, no gain philosophy. So please, just a gentle stretch. Hold it for 30 seconds, come back to neutral, and then go to the other side. Same thing, 30-second stretch, hold it for 30 seconds, and you're going to do it 3 times. Come back to neutral. And then we're going to do what I call the smelly armpit stretch. So you move your arm toward your armpit, okay? The stretch you feel, it should be right back here and even go through your mid-back. Remember, with all stretches, you just want a gentle stretch, not pain. If you're really tight, these can cause you a lot of pain. Go to your other armpit. You're going to do all of these 3 times for 30 seconds, just a gentle stretch. All right, now we're going to do the opposite, okay? Instead of looking down at a diagonal, you're going to look up at a diagonal. So you're going to look up that way. You can use your opposite arm to support here on your other shoulder. All right, to kind of provide some stabilization. And the stretch is going to be here on the front of your neck. Feels really good. All right, so again, 3 times 30 seconds, both directions. Now Angela's going to turn sideways for us here, and posture is extremely important. Okay, so I want you to work on squeezing your scapula together. That helps hold your upper back up nice and straight instead of slouching. All right, so you're going to hold that, and I want you to do about 10 of these. Hold them for 10 seconds, okay? And then I want you to hold this while you do this next exercise, and it's called a chin tuck, and this is actually the golden exercise for neck pain. So you can put your hand here. Don't really push with your hand, it's just for a guide. And I want you to bring your chin straight back, just like you're trying to create a double chin. Hold that for about 10 seconds and then slightly relax. And you're gonna do that 10 times, okay? These are all easy exercises. They can be done, anywhere, sitting, standing. Sometimes, I even do them driving down the road. Normally at a stop sign is best. We don't want to do any crazy driving or anything. So always be safe, and always come back here on Thursdays to see what we're going to be talking about and how it can help you here on Therapy Thursdays.